Gamma knife is a radiosurgical tool. It's not a knife, but it's a machine that focuses radiation into certain parts of the brain to treat a variety of neurological problems.
It would be the gold standard of cranial radiosurgery. It uses approximately 200 different angles of radiation to deliver radiation within the accuracy of 0.15 millimeters. And there's no other radiation treatment machine that can deliver with that kind of accuracy.
You imagine when we were all kids, we played around with magnifying glasses on a hot summer day where you can focus those rays onto one point. And you can pass your hand anywhere under there as long as you don't hold it right where those rays all come together at one point. That essentially is what the gamma knife is doing. It's focusing cobalt energy at one point. So you have a little sphere of energy, and we can shape that treatment plan based on the machine because it has a robotic couch. And so we can add up lots of little pinpoint balls of energy to treat even very complex shaped lesions in the brain.
I think probably something that separates gamma knife from other types of radiation procedures is that it's as efficient as it is accurate. So on the day a patient gets their treatment, they come in, we can do the treatment planning on that same day and deliver the same treatment all within one morning, and they get discharged to their home.
And regarding the preoperative workup, generally it's one visit with the neurosurgeon and the radiation oncologist, and that can even be done over the phone or via video link.
It's a computerized treatment planning system. So we get the MRI scan from that morning, and it's essentially real-time planning where we can use that MRI right away, and then we denote where the tumors are that need treatment or targets. And then we design a plan of how to bring those doses in.
This is absolutely the gold standard in cranial radiosurgery, and it has revolutionized the treatment of a number of disorders. And I can vouch from having had a career where I've operated on all these conditions. Now I'm able to treat them less invasively with much greater degree of precision. I feel I have pretty steady hands as a neurosurgeon, but they're still nowhere close to being as steady as this machine is.
The risks are very minimal, and that's because the accuracy of this treatment is so high. So when you're really pinpointing your treatment into the disease process itself, well, that's fine. We want the dose there. You're not going to get a complication from getting too much dose to the tumor. The complications typically come in the fall off area of the radiation, and there's no treatment machine that has a faster fall off of the radiation than the gamma knife. So this is an extraordinarily well tolerated treatment with very minimal side effects.
I would say they're very appreciative of being able to have their condition treated in such a minimally invasive fashion, to be able to come in and be with their family even while they're having their treatment essentially, and then being able to walk out without all of the typical risks that you associate with having brain surgery.
You know, we take a lot of pride, especially being in central Wisconsin, to be able to provide excellent high-level care to people all over the state.
We're certainly happy to consult with anybody who has a question whether they would benefit from it, and we can advise them as to whether they would be a candidate for the therapy or not, or what the alternatives might be.